The purpose of this short video is to demonstrate the ease and speed with which icatibant, known by its trade name Firazyr, can be administered to patients with hereditary angioedema, which is commonly abbreviated to HAE. HAE attacks can occur in the skin, usually the extremities of the hands and feet, the abdomen and the head and neck, including the larynx. Submucosal angioedema in the respiratory and gastrointestinal tracts can cause severe discomfort, but if the swelling occurs in the larynx, causing laryngeal edema, this can be life-threatening. Immediate treatment in these cases becomes critical. For these patients, a visit to the hospital emergency department is usually required in order to receive the necessary treatment. Cutaneous attacks are commonly uncomfortable, disfiguring and disruptive to day-to-day life, but are generally not life-threatening. As such, patients with spontaneous and recurrent attacks of subcutaneous angioedema affecting the extremities may come to a daytime clinic for treatment. These patients tend to contact the clinic, attend an appointment and receive treatment within 48 hours. Recently, Firazyr has been indicated in the EU for symptomatic treatment of acute HAE attacks in adults with type 1 and type 2 HAE caused by C1 esterase inhibitor deficiency. For all appropriate HAE patients, the administration of Firazyr is quick and easy, and is essentially the same as for most subcutaneous injections. With a total preparation and administration time of less than 3 minutes, this treatment option provides a convenient and simple method for reducing the swelling attack and improving the patient's condition. Firazyr is provided in a pre-filled syringe that can be kept at room temperature and is administered as a single dose of 3 ml. This makes it ready to use at a moment's notice in the treatment of appropriate HAE patients, in contrast to other available treatment options that require, for example, an intravenous infusion. The administration of Firazyr needs no dose calculation or titration. After the patient has been assessed and Firazyr has been prescribed, the packaging is opened and the contents are removed and carefully placed near to hand on a clean surface ready for use. First, the cap on the end of the syringe is removed. Then, the protective cover of the needle is removed and the needle can be attached to the syringe. The injection site, usually the abdomen, is then swabbed and sterilised prior to the administration of the product. Finally, the needle safety cover is removed and the injection is administered subcutaneously. It should take about 30 seconds to administer the entire contents of the syringe. After the injection, the patient remains in the clinic for a short observation period. During this time, the progress of symptom improvement is monitored to ensure the HAE attack is subsiding and that there are no unexpected adverse reactions. Common reactions can include redness and swelling, and in a few cases itching and pain at the site of injection, but these symptoms usually resolve without the need for further medical intervention. Once the patient's recovery is deemed satisfactory, they can be discharged and can return home. Before discharge, however, they may be given a second Firazyr syringe. Should the patient's symptoms recur, this additional dose would then be immediately available to be administered by any healthcare professional.